Poisoning. Now, poison, which is also called a toxin, is defined as a substance which, if taken into the body in sufficient quantity, may cause temporary or permanent damage to that person. Now, poisons are not only swallowed or found in food, they can also be absorbed through our skin or our eyes. They can be inhaled through our nose, or they can be injected into our body. And once a toxin is in the body, it can then get into the person's bloodstream or into our bloodstream and be carried quite quickly to any of the body's organs and tissues. So let's have a look at swallowed poisons like chemicals then. Now, with swallowed poisons, these may actually harm the digestive tract or cause more widespread damage such as burning, swelling and blistering. And this is in addition to the actual damage they do as they actually enter the bloodstream or transported to other parts of the body. And these chemicals include many of our household cleaning products or dishwasher tablets and detergents. Drugs are also included in this list. And these can be things that are legal, such as over-the-counter, or it could also be illegal drugs as well. And the effects of poisoning will just depend on the substance that has actually been swallowed. But they may include things like vomiting, and it can sometimes be blood-stained. You can feel nauseous, diarrhea, impaired conscious levels, pain or burning sensation. You might also see lots of empty containers that used to have drugs inside, or of course you might see those chemicals out and empty as well. Now, the treatment firstly is to identify what has actually been taken. Ask the casualty if they've swallowed anything, how many have they swallowed, what have they swallowed, and try to reassure them and call the emergency medical services and try and give the emergency medical services as much information as possible about the swallowed poison, because this information will assist doctors to give the appropriate treatment once that casualty reaches hospital. Now, if the casualty does become unconscious, always make sure you open the airway, look, listen and feel for breathing. And if they're not breathing, you're going to have to perform CPR. And this might involve you giving rescue breaths. Always be aware of cross-contamination from a chemical they've got into your mouth. So a face shield would be the best thing to use. Or of course you could close their mouth or cover their mouth and blow in through their nose. If they're unconscious but breathing, do you remember the position we put them in? The recovery position. And in both the CPR and recovery positions we've learned in videos previously as well. It's really important though, if someone is conscious, that you do not induce vomiting, as vomiting can cause more damage and the chemical then can actually cover the whole of the respiratory tract, mouth and also inside the nose, causing more respiratory issues. Now, I would say with poisoning, always make sure you stay calm, which I know is easier said than done. Try not to scream or shout at that person that has ingested poison, because they might not tell you how many or what they've actually ingested because they're scared. So try your best to stay calm. Now, food poisoning is another way we can be poisoned. And food poisoning is caused by eating food or drink that is contaminated by bacteria or viruses, and it can normally develop within hours or maybe up to a day after eating that contaminated food. Some food poisoning is caused by poisons from bacteria already actually in the food, such as Salmonella or E. coli. Now, these are mainly found in meats and are actually probably the most common causes of food poisoning here in the UK. Now, one serious problem of food poisoning is dehydration. This is because bodily fluids are lost from vomiting or diarrhea and they're not replaced quickly enough. And this is especially serious for the young and also the old, or if you're living in a hot climate, which the UK is definitely not. And in some cases, this dehydration can be very serious and it might need to be treated in hospital. So signs and symptoms then of food poisoning will include being sick or feeling nauseous, cramping and abdominal pain, diarrhea, which actually could be blood-stained, a headache or a fever, signs of shock, impaired consciousness levels. And the treatment is always to encourage the patient to rest and make sure they stay hydrated, so drinking plenty of fluids, and also things like rehydration powders like Diarrhelite or isotonic drinks be really helpful. And you may need to seek medical advice, medical assistance. And finally, if someone does have food poisoning, you also need to ensure that no one else is affected, and obviously if there are, you need to treat them as well, And in some cases you might need to report it to the authorities or to the employers. We can also be poisoned by things in our garden or local woodlands. And care does need to be taken with children and pets, as when going on a walk, little children tend to put things in their mouth and they swallow different types of plants or fungi, which can result in someone being poisoned and being very unwell. Now this is quite rare, but it is a serious condition and different things can cause different problems. Have you ever heard of the foxglove plant? Now the foxglove plant's been called lots of other names such as dead man's bells, dog's fingers, fairy gloves, lion's mouth, and lots of other names. During digestion, the toxins are produced that directly affect the heart muscles that will then slow the heartbeat down and can cause somebody to have a heart attack. As well as that, it's going to make someone feel very unwell, nauseous, diarrhea again. Some berries that you might find on trees might look very tempting to eat, but they could also be poisonous. Some mushrooms and fungi can cause nausea and vomiting and sometimes hallucinations. The death cap mushroom, for example, causes severe watery diarrhea between 6 to 12 hours after ingestion, as well as vomiting, and it can be fatal. If you suspect someone has been poisoned while you're out for that walk in the woodlands or even in your garden, try and work out what they've been poisoned by, which part of the plant they've been poisoned by, take photos if need be, or try and take the plant or the fungi with you so the doctors can take the appropriate action. Always make sure that you reassure somebody you are trying to help, as they might be upset or scared about getting into trouble, so they might not tell you the truth. In other words, they might not give you the correct information. This is especially true with young children. Tell them to try and say exactly what they've eaten and also how much, and try and gain that person's trust, whether it's a child or an adult. And you do need to get immediate medical advice from your doctor or call the emergency medical services if needed, because poisoning can be fatal. And remember what we said about if they go unconscious and stop breathing. Make sure that you are protecting yourself when giving rescue breaths to somebody. A face shield or cover their mouth and blowing through their nose. And never ever induce vomiting if they were conscious. But I always believe prevention is the best way forward. So try to know what's in your garden. Try and know what plants you have in your house. Are any of them dangerous to pets or children? I know when I first got my little dog, I had to make sure that the plants in my garden weren't dangerous and replace the ones that were. And if in doubt, always get advice. Prevention is better than cure. So go and have a look now in your garden and see if there's anything out there that could be dangerous to children. Even if you don't have children, you might have friends and family that bring children around to your garden, and you don't want them to be poisoned by plants or fungi that you have. Don't forget to hit that subscribe button so you don't miss out on any of our important videos.